Hello everyone. So here's the explanation for the question which was posted previously. That is, X-ray films have an emulsion on one or both sides of a support material. The emulsion contains particles of A. Silver nitrate crystals, B. Metallic silver in gelatin, C. Silver bromide in gelatin, option D. Silver nitrate in gelatin, and option E. Potassium bromide in gelatin. So the answer is C, that is silver bromide in gelatin. The X-ray films, they help to record the information regarding the tissue through which the X-rays pass, and hence they greatly help in the diagnosis and treatment of the patient problem. So image recorded on the film, it is caused by exposure to photons. The composition of X-ray film includes base, adhesive and emulsion. Base contains polyester polyethylene terephthalate, adhesive, and then emulsion, it contains silver halide grains and the vehicle matrix. As the emulsion layer has two principal components, that is silver halide grains and the vehicle matrix, it contains of homogeneous mixture of gelatin and silver halide crystals. In typical emulsion, 90 to 99% is silver bromide and about 1 to 10% is silver iodide. The presence of silver iodide produces an emulsion of much higher sensitivity than a pure silver bromide emulsion. It also contains traces of sulfur. So film base, it contains emulsion, that is silver halide, and a protective gelatin layer is present, adhesive is present. In a cross-section X-ray film view, there is a super coat and then emulsion coat. Beneath emulsion there lies adhesive, and then base is present. Again adhesive, emulsion and the super coat. Uses of dental radiographs include for the assessment of periodontal status, in the endodontics, assessment of apical surgeries, detection of any apical cyst after any dental trauma, and assessment of the root morphology before the extraction. Learn dental radiographs and skill yourself in dental radiography with Master Clinical Dentistry Institute. Master Clinical Dentistry Institute offer many courses such as ADC exam coaching so that students can clear their ADC exam and practice in Australia, then NDEB exam, NBTE exam courses. Customized courses are there so that students can prepare the best. We offer many clinical courses such as basic endodontic courses, advanced endodontic courses, removable and fixed prosthodontic courses, implant courses, lasers in dentistry and aesthetic courses, and many more. Study from anywhere around the globe. Study from your home with Master Clinical Dentistry Institute and online dental programs. Master Clinical Dentistry Institute provide 1:1 coaching or batch study. Now you can join according to your need. Customized courses are conducted by Master Clinical Dentistry Institute. We offer 100 plus online test series, revision batches. Now you can prepare for your multiple choice questions with us. Prepare before you appear for the exam. Doubts are cleared by super specialized faculty members and the experienced staff. So visit Master Clinical Dentistry Institute, that is www.masterclinicaldentistry.com. You can call or WhatsApp 788-909-3147. So you can also like, share and subscribe our YouTube channel too.